Ramaphosa addressed the nation on two primary issues: the closing of schools and the government's commitment to fight the scourge of corruption under lockdown. Take a look at this.
But what concerns me and what concerns all South Africans are those instances where funds are stolen, where they are misused, where goods that we have to procure are overpriced, where food parcels are diverted from needy households, where there is corruption and mismanagement of public funds. Increasingly, we're hearing allegations about the fraudulent UIF claims, overpricing of goods and services, violation of emergency procurement regulations, collusion between officials and service providers, abuse of food parcel distribution, and the creation of fake non-profit organizations to access relief funding. From the outset of our response to the pandemic, we have been quite clear that there should be no scope for corruption in the use of these public resources. More so than at any other time, corruption puts lives at risk, particularly at this time and in any other time, of course. We therefore put in place several preventative measures. National Treasury issued regulations to ensure that emergency procurement of supplies and services meet the constitutional requirements of fairness, transparency, competitiveness, and cost effectiveness.
The legitimacy of vital COVID-19 economic relief programs have been questioned. The State Capture Commission of Inquiry has zero convictions, and many disgruntled South Africans have taken to social media to compare what is currently happening with the Zuma era. Corruption Watch released a report which points to the devastating impact of graft on the lives of people reliant on receiving basic healthcare services from public health facilities in South Africa. To discuss this, I'm joined by Mzwandile Banjwatha, who is the projects coordinator at Corruption Watch. Good morning, Mzwandile. Thank you so much for joining us on Weekend Dawn. My first question, obviously, is will the president do something about this corruption issue? And we actually I read a tweet earlier on the show where they were saying corruption seems like it's ingrained in South Africans, like it's part of our DNA. Is that a thing? Can we actually get over this?
Look, I think what we just need to do is just to ensure that law is enforced. But of course, the tweet that you're referring to is equally troubling. Troubling because it's based on the reality in South Africa. I mean, you look at the snapshot from the Eastern Cape where there is a demonstration of serious causes of concern. I mean, you have this 10 million for scooters, which may or may not be ambulances. You have handwritten invoices of amounting to about 4.8 million for door-to-door campaigns during a stay-at-home lockdown. I mean, you have rotten maize which are distributed to hungry people. You have councillors who are brazenly stealing food meant for the poor. So it is quite troubling. But what we need to see right now, as you rightfully stated in your introduction, that we have these commissions of inquiry that have been set up. We have various legislations that are equally in place. What we need to start seeing now is prosecution that leads to convictions, particularly for senior officials, which would also boast or build trust, a trust deficit that is now very much big between the states and of course, members of the public.
I like the fact that you bring up the Eastern Cape bicycles or ambulances, however you want to address them or identify them as. And I want to specifically talk about health being showed up by COVID-19 and showing that the health has been a problem generally for a very long time. COVID-19 has obviously opened up that and showed that health is a problem generally, and the corruption continues to show that our health system is actually failing. On the report that you guys released, what is there in terms of an indication that What can save this health system that we're currently experiencing?
Look, the report is actually based on the number of reports that we've been receiving from members of the public. Since 2012, we've received over 28,000 reports. About close to 700 of those reports are actually from the health department or focusing on the health sector specifically. And 52% of these reports speak to corruption that is happening in provinces. 40% of these reports speak to corruption that is happening at national government. We are receiving a huge influx of reports from Gauteng. About 39 reports of these are from Gauteng. About 16% come from KZN. We have the Eastern Cape and Mpumalanga, which are at 6%. So the prevalent forms or the types of corruption that we are getting are employment corruption, which is at 39%. There's procurement corruption as well, which is at 22%, and misappropriation of resources, which is at 16%. So when we look at the Eastern Cape, it tends to be it tends to rank higher on the misappropriation of resources. So this would be where money which is allocated by Treasury for particular projects and program is actually squandered or deceptively redirected to other interests. We have received reports of doctors in most cases who use state-funded medical equipment and medication for their own private practices. We're also getting that officials are illegally using various state resources like your vehicles, accommodations, and so forth for their own private uses. So the outcomes of such is a negligence and corruption acts which leads to shortage of medications, equipment that is lost or actually damaged, and the state tends to pay an exorbitant price for this. And we know that this negligence does not only lead to the shortage of medication, it also adds into the overall medical legal claims that we see that are on the rise as we speak right now.
Now, let's talk a little about corruption on the whole, the irregular awarding of tenders and the inflating prices of PPEs, etc. Where else are there issues when it comes to corruption, especially on the back of the awarding of tenders?
So Limpopo is ranking quite high in the reports that we have been receiving, particularly in the irregularities of procurement processes. So this would be where, of course, prices are inflated without any thorough justification. We find that there are documents rather that are amended or sometimes destroyed to disadvantage some of the competitors. There is preferential treatment that comes in a form of favoritism and nepotism as well. So officials are the ones that tend to benefit a lot from this, particularly through kickbacks. And we were told that in actual fact, some of these kickbacks would amount to around 10% of the overall tender. And we know that these tenders could go up to millions and millions of rands.
Now, in terms of where we are going from here on, how does government deal with this irregular awarding of tenders and inflation of prices, all the things that have got to do with corruption? Can we expect something to be done, considering that more money has been allocated to the COVID-19 relief fund?
Look, from the onset, we have raised these concerns about possibility of this abuse and violation of the emergency procurement regulation. We have for a very long time clearly stated that the National Treasury, which has issued regulations which are meant to ensure that the emergency procurement of supplies and services are actually fair, they are transparent, they are competitive, and they set a cost-effective measures, right? But unfortunately, what we are seeing is that there is this continued presence of corruption within, particularly the health sector, and generally in the misuse of these funds, the continued preferential treatment that we are actually seeing. So what we are asking for right here is to have more transparency and more accountability. But that alone does not necessarily encourage or rather breach the trust deficit. What we need to start seeing right now is prosecutions that lead to convictions, like we have stated earlier.
So, in your opinion, do you think something is going to be done now that the President has appointed the likes of the South African Revenue Service, the SIU, Special Investigating Team within the NPA and the SAPS? Do you think something will actually be done, considering that, I mean, the corruption started as early as April when we went into lockdown? Can we expect something to be done soon?
So we are optimistically cautious about this whole thing, but everything is put in place. I mean, we won't be sure what would happen to actually stop prosecution after everything has been put in place. I doubt if there would be any setbacks in this instance, not unless, of course, there is continued political meddling in this whole process. But as it stands, we think that the President is taking very good steps and very good measures in ensuring that those who are corrupt are actually held accountable, or those who are implicated in all of these corruption acts are actually held accountable. So this is a right step from the President. We hope that maybe this would have came in a bit earlier, so that by this time we're talking about people who are facing convictions.
Mzwandile, thank you for your time. That was Project Coordinator at Corruption Watch Mzwandile Banjwatha, speaking to us about corruption in the health sector, saying that it's the most vulnerable who bear the brunt of corruption in the sector.